Assalamu alaikum. For our PHD211's group video assignment, our team will be discussing about a skin condition called Paederus dermatitis, or in layman term, Charlie bite. This condition is caused by a toxin called paederin that released from Paederus species, or Charlie ants. This toxin will penetrate the skin epidermis and cause a delayed reaction, which usually lasts from 12 hours to 36 hours, that leads to necrosis. This also leads to tissue response and inflammation that matures the lesion, thus leading to increase in blistering.
For the Paederus dermatitis condition, we decided to choose corticosteroid cream, which is betamethasone valerate that has the strength of 0.1% weight over weight. This medication penetrates the epidermal cells and binds to glucocorticoids receptors that leads to downregulation of pro-inflammatory cytokines, which are interleukins 1, IL-1, and tumor necrosis factor alpha, TNF-alpha. It also suppresses phospholipase A2 that reduces prostaglandins and leukotrienes that causes inflammation.
Now, I will explain some common mistakes people make when applying topical medication such as creams or ointments. These mistakes include applying the medication into a thick layer, applying it to the unaffected areas, skipping skin cleaning before application, and rubbing the medication vigorously into the skin. First, applying thick layers. Topical medications are designed to be used in a thin, even layer. Applying too much does not improve effectiveness and can increase the risk of side effects such as skin irritation or skin thinning. Second, applying medication to the unaffected areas. Topical medication should only be applied to the affected area. Applying them to normal skin may cause unnecessary drug exposure and increase the risk of adverse effects. Third, not cleaning the skin before application. Cleaning the skin is an important step before applying topical medication. It helps remove dirt, oil, sweat, allowing the medication to absorb properly and work effectively. Lastly, rubbing the medication vigorously into the skin. Topical medication should be applied gently. Vigorous rubbing can irritate the skin and does not increase the effectiveness of the medication. In conclusion, proper use of topical medication includes applying a thin layer only on affected areas, on clean skin, and with gentle application. Following this step helps ensure safe and effective treatment.
For the final part, I will show you the proper way to apply topical medication such as creams or ointments. This includes applying a thin layer, applying only to the affected area, washing and drying the hands and skin before application, and rubbing the medication gently. Apply thin layer. Apply thin layer only to increases the surface area to allow proper penetration. Apply to affected area only to avoid causing side effects on top of the unaffected area. Wash and dry hand first to increase drugs penetration, since oils, sweats, and residues can hinder drug absorption. Rub gently. Gently rub the medication onto the affected area in circular motion to effectively distribute it around the area. In conclusion, Paederus dermatitis or Charlie bite is a skin condition caused by the toxic paederin that leads to inflammation and blistering. Using a topical corticosteroid such as betamethasone valerate 0.1% helps reduce inflammation and control symptoms by suppressing the body's inflammatory response. However, the effectiveness of treatment also depends greatly on correct application. Therefore, I urge both physicians and patients to understand and follow the basic steps of proper topical medication use. Applying a thin layer only to the affected area, ensuring the skin is clean and dry, and rubbing the medication gently and can significantly improve treatment outcomes while minimizing side effects. Simple correct practices can make a big difference in safe and effective skincare.